Zambula, and a very warm welcome to this special episode of Drungtsho BBS in English. I'm Thong, and this week from 1st through 7th August 2025 marks World Breastfeeding Week, which is observed globally under the theme Prioritize Breastfeeding, Create Sustainable Support System. And this campaign calls for stronger health systems, supportive policies, and community solidarity to ensure every mother and baby has the support they need. And today we are honored to be joined by Dr. Dinesh, a pediatrician, and Nurse Tanti, who from the Mother and Child Care Hospital, who will share their insights from their frontline experience on how breastfeeding nurtures health from infancy through maternal well-being. And I'd like to request the viewers to stay tuned and join in the conversation, and let's together discover how investing in breastfeeding truly means investing in the future for every mother, every child, and for every community. So thank you so much, Dr. Dinesh and Nurse Tanti, for joining us today. And to begin with, I'd like to go with Dr. Dinesh. So as I've said already, we are participating in this global initiative under the theme Prioritize Breastfeeding, Create Sustainable Support System. So what does this theme mean to you based on your professional experience?
Yes, thank you. Thank you BBS and Drungtsho BBS for inviting us to advocate on breastfeeding. This year's theme is prioritize breastfeeding and to create sustainable support systems. It basically means that every mother who has a baby requires the support of her family, from her workplace, from society as a whole, to continue to breastfeed, only breastfeed for the initial 6 months, and then continue to breastfeed till the child is 2 years of age. And we need to have a whole of society approach for this. It is not only the mother's responsibility or the family's responsibility. Those mothers who work also need to have a supportive system at the workplace so that she can continue to breastfeed her child, only breastfeed till 6 months and then continue for 2 years. So we need to have conducive policies in place so that mothers get the required maternity leave. In the civil service, we have 6 months. We have had that since 2017, but in the private sector, in the corporate sector, we don't have such policies, and we have seen that in the corporate sector it's only 3 months, and in other private offices it's only up to 1 month or 2 months. So we need to advocate to increase this maternity leave, paid maternity leave, for up to 6 months. And also from a medical health point of view, our health workers also need to be able to support mothers who are breastfeeding. So it starts right from the period they are pregnant, how to educate them on the benefits of breastfeeding, and before the child is even born, before the baby is even born, how to educate them on the benefits of breastfeeding, how to hold their baby, how to put the baby to the breast, and when to feed, how to know if the baby is satisfied or not. These are all things which we can train the mother during the pregnancy period itself. And right after the baby is born, the health workers who are there at the time of delivery should be able to support the mother so that she has a good experience of breastfeeding. So this whole theme revolves around creating a good environment, a support system for the mother. And this year's theme is especially linked with climate change and environment, because if we ensure breastfeeding succeeds, then we also ensure that the environment is protected and we can prevent climate change. Because rather than breastfeeding, if we focus on formula feeding, which is a very labor intensive, very wasteful process which uses a lot of resources like water, electricity, then it is very harmful for the environment.
Yes, thank you so much, Doctor, for elaborating well on the theme for this year's World Breastfeeding Week. And to Nurse Tanti, let's talk about exclusive breastfeeding. So since 2016, I think the country has strived towards increase exclusive breastfeeding rate, and various efforts are made to achieve this goal. So I'd like to know what exclusive breastfeeding is and why it is important.
Before I answer your question, thank you BBS for having us today here, and it's a great opportunity for us to advocate. So thank you very much for giving us such a good opportunity. So now coming back to your question, exclusive breastfeeding means like feeding only breast milk, not even a drop of water, right from the baby is out from her mother's womb. And that as per the WHO definition, exclusive breastfeeding means till 6 months, not only feeding only mother's milk right from birth till 6 months. Then from 7 months onwards, we introduce complementary feeding, and still after introducing complementary feeding, they have to continue breastfeeding till 2 years and beyond.
Yes.
And why it is important, because breastfeeding, I mean the breast milk is not just about that breast, the milk, it's more than that, the very, like, you know, the white, that milk that mother is producing. And what we say is like breast milk will protect this baby from lots of infectious disease. Breast milk has the lots of I mean, like, got lots of antibodies, so it will protect infection. It gives them, builds their immunity, it builds their IQ, their intelligence level.
Yes.
And it prevents them from many adulthood diseases like diabetes, obesity, cardiovascular disease like heart disease. And also, if you can breastfeed your I mean, if a mother can breastfeed exclusively till 6 months and continue till 2 years and beyond, it will help in preventing all these diseases.
Yes. So nurse, what is allowed and what is not during exclusive breastfeeding?
So during exclusive breastfeeding, as I mentioned, like not even a drop of water except mother's milk.
What about micro supplements or vitamins?
So micro,
baby
whatever
requires?
the supplements that we need to give to the baby is being given, like the MMS that we have in the country at the moment. It's being introduced only after introducing the complementary food, which starts from after completing 6 months.
Yes. So Dr. Dinesh, I'd like to know what are the steps taken to promote and enhance exclusive breastfeeding in the country?
Yes. So since 2015, we have been observing this World Breastfeeding Week. In 2015, we had this National Nutrition Survey, which showed that only 51% of mothers were exclusively breastfeeding their children. And efforts were taken by the Ministry of Health, especially the nutrition program and the reproductive maternal newborn health program, to increase this rate of exclusive breastfeeding. And in 2023, as part of the comprehensive mother and child health program, which has 10 components, lactation management, which is the breastfeeding support, is one of the very crucial components. Since last year, we have been developing a course for all the relevant healthcare workers who are involved in maternal and child care, newborn care, to help them to improve their knowledge and skills on how to provide breastfeeding support and do lactation management. So in April of this year, we launched this course. It is as a blended learning course, which means there is an online component which is hosted on the Geselgebe University's website. They have to learn this course online and then come for an attachment with Sister Tandin and actually go have a hands-on practice of observing mothers who are breastfeeding, assisting them, providing them support, and then addressing any issues if there are relating to breastfeeding. So this training, this week what we have done is give lectures based on this training, on this online component, give lectures over Zoom to health workers all over the country. And we are doing this physically in Thimphu, in Gelson Jesenpema Mother and Child Hospital. But then over Zoom, we are able to cover more than 100, 200 health workers who are tuning in and listening to our lectures. And they need to practice this knowledge and skills on the mothers and then support them in breastfeeding. The other thing is, as part of the Accelerating Mother and Child Health program, which was launched on His Majesty's birth anniversary, we are to eligible women, women who are in rural areas, who don't have a job, who are dependent on their husband's salary, to come to avail this antenatal and postnatal checkups. We are providing them with a conditional cash transfer, cash incentive, so that they can cover the transportation cost to the hospital, so that they can come to all the postnatal checkups, antenatal checkups, and that's when we train them on how to breastfeed, how to avail breastfeeding services. Even in the postnatal period, they can come and address their health breastfeeding related problems. So these are a few initiatives that the ministry has taken of late.
Yes. So Nurse Tandi, as a figure who plays an important role in the lactation management unit, we'd like to know what are the services provided in that clinic.
So antenatally, what over here in Thimphu Lactation Clinic, what we do is when this woman reach 36 weeks gestation period, all the women we give class to all the all the antenatal women.
Yes.
So the topics that we cover during this time are the importance of breastfeeding and how to position the baby after delivery, how to attach the baby to the breast, and we also clarify the myth and mythicals. We have we have lots of myth and mythicals and traditional cultures, like we have to the moment baby is out of the mother's womb, we have to welcome the baby with butter, so that the baby remains wealthy throughout the life. Or the southern part will feed with the honey, so that the honey is the richest food, so the baby will remain rich throughout life. So these are the cultures that's been, these are the myth and mythicals, misconcept they have. So we clarify all this, and also we teach them common management of common breastfeeding related problem, how to manage if it is minor, and we teach them like to recognize feeding hunger cues, when to breastfeed. So, and also we teach them, like, you know, after delivery, most of the people, what they do is they restrict some diet, put some diet restriction on this mother, like saying, if mother takes butter, baby will develop jaundice. Yes. If mother takes vegetable, baby will pass black stool. So they have all these misconceptions. So we do clarify all these misconceptions during antenatal time. And we also like advocate them after delivery, if they have problem, where to seek the breastfeeding related problem. That is definitely our lactation unit.
So is that a part of a routine checkup, or it's scheduled?
So it's like it falls within their routine checkup schedule.
Yes.
So during the pregnancy time, they will attend one-time class. That's like they will be given an appointment. So once they reach 36 weeks gestation, we do take class once every Saturday. It starts from 9:30 a.m. So they will be given an appointment during the antenatal checkup. So they don't have to come separately during other time. It falls during the regular ANC checkup time.
Yes. So nurse, could you also inform our viewers when does these classes take place?
So it takes place once they reach 36 weeks of gestation, and they will be given appointment by the antenatal checkup unit. So, and it happens once every Saturday. We kept Saturday because most of the office go are off on Saturdays, so we chose Saturday.
Yes, that's. So doctor, are the lactation management, how is the lactation management unit distributed across the country?
Yes, initially, since 2014, we have had this lactation management unit at the Jimito Juwanshu National Referral Hospital under the Community Health Department. And since then, we have taken efforts to create similar units in the regional referral hospitals in Mongar and Gelefu.
Yes.
And from this year onwards, once we had the training program in place, we called healthcare workers from nurses and HAs from 12 hospitals of the western region.
Yes.
And we, after learning the online component, they came for a physical attachment of 1 week, where they got trained, and then we gave them supplies like mannequins, and there is a mannequin which simulates a breast. So they show a mother how to hold the baby, even during the pregnancy period, how to hold the baby, because this is not something that instinctively a mother learns right after delivery. So she has to be trained in this. So how to hold the baby, how to sit, how to put the baby to the breast, and also to address all these common issues. So we have plans, the Ministry of Health has plans to expand these lactation management clinics in the central and eastern parts of the country as well in this financial year. And hopefully we'll have in all the major hospitals where women come for antenatal and postnatal checkups, we'll have these clinics in place maybe in the next 1 or 2 years.
Yes, thank you, doctor. So earlier, Nurse Tanti had shed some light on some of the existing myths and misconceptions surrounding breastfeeding in our country, which includes social and cultural norms. So are there other factors that hinders or affects milk production, or in a way affects breastfeeding?
Yes. So first of all, rather than talking about the hindrance, let's talk about the factors which
Factors,
help the women.
yes, yes.
So a mother who is happy after delivery, a mother who is happy, confident, and who is pain-free, who has received support from her family and healthcare workers to initiate breastfeeding and continue breastfeeding, is a calm and stress-free mother who can have a good milk production and continue to breastfeed her baby, who is in the right frame of mind to breastfeed her baby. But at the time of delivery, if she has a lot of pain because she has undergone a C-section or a instrumental delivery, if she has a perineal tear which needed suturing, she's not able to sit, and if she has a headache because of the cesarean section, or if she doesn't get the required support from her family members or healthcare workers, and then she doesn't know how to hold her baby, doesn't know how to latch the baby on her breast, these factors hinder her baby. She's then very tensed, very stressed, and these factors lead to a very bad breastfeeding experience, and these in turn affect her milk production and also her whole experience around breastfeeding, and that is when they switch to the easier option, which is to give formula milk. So it is very important for her, the family members to support her, for health workers to support her, and then to ensure that she is in a pain-free, unstressed, in a stress-free environment. So this is what we are talking about, creating a supportive environment. And moving forward, she may have a good experience of breastfeeding for the first couple of months, but if she is a working mother and she has to go back to work after 1, 2 months or 3 months, in the civil service it is 6 months once the maternity leave is over, she may not continue to breastfeed because she has to be at work, she cannot take her baby to work, and even if she can take the baby to work, there is no place in the office where she can safely and breastfeed in privacy. So if you don't have such kind of facilities at the workplace, then she will gradually switch to formula feeding, or the breastfeeding rates gradually drop over time. So we are advocating for a paid maternity leave for at least 6 months in all areas, government, private or corporate sectors. And at the workplace, we should, if there are feeding mothers, they should have a room where they can bring their baby and breastfeed. And there should be facilities, if she cannot bring her baby, at least a place where she can pump her milk and then send the milk home. Such kind of facilities are required in all workplaces.
Yes, thank you, doctor. Now to Nurse Tandila, it is universally proven or undeniable that breast milk has benefits for the baby, but it is also said that it has equal benefits for the mother, for the family and community as a whole. So I'd like to know what are the wide range of benefits breastfeeding has for the mother specifically.
So coming to advantage of breastfeeding for the mother.
Yes.
So firstly, the moment she give birth, if she the moment immediately after giving birth, if she start breastfeeding, it will help in contraction of her uterus. So that will help in prevention of bleeding. So that's the immediate impact that she can see, the advantage of breastfeeding that she can see immediately after breastfeeding. So if she can if bleeding is stopped, and there's she can prevent from the risk of dying is less for her.
Yes.
And then later on, that's an immediate advantage. Then that will help, breastfeeding will help in her emotional well-being also. So that will reduce her stress. Then it will reduce in breastfeeding also helps in reducing the weight that she gained during pregnancy.
Yes.
So what the misconception that our people has is just because she is breastfeeding, she has put on weight. It's just the opposite. If she breastfeeds, whatever weight she has gained during her pregnancy, she can reduce that. Breastfeeding can help in reducing the the weight that she gained during pregnancy. And then later part of life, if she breastfeed now, it will help in reducing the chances of her, the risk of her getting the breast cancer and ovarian cancers is being reduced. And also we women, at the moment we are menstruating every month, so we are producing hormones, so there is no problem. But once we stop menstruating, we do not produce hormones, so it leads to osteoporosis, something called like bone softening.
Yes.
So if she can breastfeed now, this will help in later part, like the risk of bone softening will be reduced.
Yes. So, doctor, what about women who have challenges breastfeeding a baby, and maybe because of psychological conditions like stress, anxiety, or depression? So, are there any available support systems or services for those women?
Yes, it may be a mother who already has pre-existing mental health conditions,
Yes.
but even if she doesn't have any, right after delivery, delivery and post-delivery period is a very stressful condition. It's a very painful condition for all mothers, and if she doesn't get the required amount of support from her family members and healthcare workers,
Yes.
it will not be a very happy moment for her. The whole, the birth phenomenon, the birth experience will not be very good for her. It can lead to a lot of stressful experience.
Yes.
So what we should try from the family's point of view, from the health workers' point of view, is that we should provide all the required support for her, like especially in making having a good start at breastfeeding, and so that the baby also gets a good start at life, and then she has a good experience of having the pregnancy, delivery, and the breastfeeding experience. So if she doesn't get the required amount of support, she's going to be very tense, very stressed, and what mothers usually feel is that she may feel like, I'm not able to be a good mother to my baby, I'm not able to give a good amount of milk to my baby, I don't know how to breastfeed, I'm a failure as a mother. So these things lead to what we call a postnatal, it is a temporary condition, it may become permanent, postpartum blues, postpartum depression,
Yes.
and usually the feeling of not being an adequate mother for her baby. So we focus on making sure that the experience of delivery and breastfeeding is good, so that she can she's self-efficacious, and she's confident about breastfeeding her baby and continues to breastfeed throughout the 6 months and going on to 2 years. And if she has any issues in the lactation management clinics, when she comes for her postnatal checkups, as part of the comprehensive mother and child health program, we have something called mental health screening in the antenatal and postnatal period, where we look at her mental condition in the checklist as well. So there we can spot red flag any mental health conditions or stressful conditions she has.
Yes.
Apart from that, the lactation management clinic specifically focuses on any breastfeeding related problems she might have, and to address these conditions.
Yes. Yes, thank you so much, doctor, for the well explained services or care that you provide to the mothers who are going through difficult times. And to Nurse Landia, I would like to know what are some of the common challenges you find in terms of breastfeeding in a woman.
So common challenges, mostly like it's related to
breastfeeding,
sore nipple,
yes.
because initially immediately after birth, like they don't know how to position the baby and put the baby properly on the breast, so they'll end up having sore nipple.
Yes.
So which leads to this mother perceiving that they are not producing breast milk,
Yes.
and that leads to giving formula feeding and bottle feeding.
Right.
And this they had already made a mind that because of they don't know that they are not being able to breastfeed, that's why they are not being producing, but they are
Yes.
thinking that they are not producing. Actually it's just their perception that they are not producing. Actually they've been producing, but it's only that they are not being able to put the baby correctly on the breast and attach properly on the breast. That's why they face this challenge. So most of the time these mothers end up giving formula and bottle feeding.
Yes. What about clogged ducts? What causes it?
Clogged duct or blocked duct.
Yes.
So that also it comes in line with not feeding,
Yes.
or not being able to take out all the breast milk that is being produced in, or she is wearing something, tight clothing, or she is sleeping with the bra and in an uncomfortable position, especially if she has a habit of sleeping in a prone position, or she is not feeding completely, or she is not feeding frequently. Maybe she is timing the feeding, and like before the baby emptied all the breast, she stops the breast, so that causes clot.
Yes. Yes. So for a comprehensive breastfeeding technique, we wouldn't go into detail in this episode. So for that, I'd like to tell the viewers you must make a appointment or look for the schedule for the comprehensive lactation management class the Mother and Child Care Hospital is providing currently. And to Dr. Nurse Thandi had shared some information on the artificial feeding. So I'd like to know what is artificial feeding and what are the risks associated with it.
So the most common reason why people switch to artificial feeding or formula feeding is because they will have a very bad experience when they are starting to breastfeed. So not being able to hold the baby properly or latch the baby properly leads to the issues like sore nipple, a nipple pain, or an engorged breast. So the milk is there, but it's not coming out, and the baby is not getting it, and the baby is crying all the time, baby is hungry all the time, mother's stressed, and then they switch to formula feeding. Now, formula feeding has many risks. Firstly, it is not the right nutrition for the baby. In terms of carbohydrates and proteins, it may be appropriate, but it doesn't have any of the antibodies that the mother produces in the breast milk. So the baby is prone to many types of infections. Baby doesn't get the right kind of nutrition. It's not easily digestible like breast milk, and baby may not gain weight appropriately. Either may gain too much weight or may not gain weight adequately. And moving forward, baby has more risks of having allergies, asthma in future, and having cardiovascular heart diseases, diabetes, or high blood pressure in the future. And breast milk has shown to lead to a higher IQ level compared to formula feeding. So, and on top of that, the formula feeding is a very expensive process. It's a very time consuming process for the mother and the family. They have to buy the formula. It's quite expensive. One box costs around 500 niltrams. It is very expensive for a family. You have to take the powder, you have to mix it, you have to cool it down and feed. So it consumes a lot of time, and it's not good for the family, not good for society as a whole. So to ensure that mothers don't switch to formula, we have to ensure from the whole family and then the health workers, we have to ensure that they have a good breastfeeding experience right after delivery.
Yes. Again to Dr. So it is said that breastfeeding within the first hour shapes a baby's immunity and cognitive development. So why is that first hour so critical, and what are the long-term benefits it offers?
Yes. So mother starts producing milk not only after delivery but even in the pregnancy. From around 20 weeks of pregnancy she starts producing milk, and then the milk is there even before the baby is born. If mother expresses, a little amount of milk always comes out. That is known as colostrum. So right after the baby is born, the first milk that is to be given to the baby is colostrum. It is produced in a small amount, but it's very nutritionally dense. It is full of antibodies and immune modulators, which not only help the baby get nutrition, good nutrition, concentrated nutrition, but also is also almost like the first vaccine for the baby. So it has a lot of antibodies which go into the stomach and the intestine and prevent the harmful bacteria from coming in. So the baby is less sick moving forward, and this concentrated nutrition is produced in a small amount as part of nature, and then the baby also has a small stomach capacity in the first few days, and the stomach and intestine is full of the amniotic fluid, the meconium, which is the first black stool. So the baby requires a small amount of milk, and then the colostrum is produced in small amounts but nutritionally dense, so that it's the right food for the baby.
Yes. Thank you so much, doctor. So lastly, I'd like to give Nurse Thandi a minute to share your key message to our viewers.
Lasla, thank you once again, BBS. So anyone who is pregnant or who is expecting to, who is near delivery, you can, if you have any breastfeeding related questions, burning issues, you can please come to lactation clinic or attend our Saturday class. It starts from 9:30 a.m. onwards every Saturday, and after delivery also, if you have breastfeeding related problem, you can immediately contact us. And after delivery, if you are a working mother, if you are working in a private corporate, and if you are not having like adequate maternity leave like till 6 months. Most of them, like Dr. shared that time, hardly have 1 to 3 months. You can always come to our unit. We teach you 2 weeks. You come to us, like visit our unit 2 to 3 weeks ahead, so that we can teach you how to express breast milk, how to store it, where to store it, how to rewarm, and how to give cup and spoon instead of switching to bottle and formula.
Yes, thank you so much, La. Thank you so much, Dr. Dinesh and Nurse Thandi, for your time today and your insights. And as we have heard, breastfeeding is a powerful investment in a child's health, a mother's well-being, and her shared future. So let's continue to support and empower mothers at home, in workplaces, and across communities. Together we can make a lasting difference, La. And this wraps up today's episode of Drungtsho BBS. Thank you so much for tuning in. Until